Hello, I'm Tony Guida. If you're like me, you are confused, frustrated, and angry that the process of getting COVID 19 vaccines off the shelves and into people's arms has been a disaster. Meanwhile, the news media and social media abound with information about those vaccines, much of it dead wrong. Well, you've come to the right place. My guest today is Dr. Vincent Racaniello, professor of microbiology and immunology at Columbia. In his lab, he has studied viruses for 45 years. Suffice it to say, there is nothing about viruses and vaccines he does not know. Stay tuned. Get educated. Vincent Racaniello, so good to see you again. Welcome back.
Thank you. It's been some time, right, Tony?
Yes, it has. And a lot has happened in that time, and a lot continues to happen every moment of every day, it seems, regarding this virus. I'm assuming you consider it imperative to get as much vaccine, as many doses of vaccine into as many arms as soon as possible. And if I'm right about that assumption, how do we make that happen?
You're absolutely right. It's actually remarkable that we have two vaccines in the US that have been given emergency use authorizations, right? When I spoke to you last, I wasn't sure there'd be any vaccine until the summer of 2021. So that's amazing. So we did a good job with that. But as you say, the distribution has been a disaster. And there is one reason for that, and that is because the federal government has left it up to the states to do it all on their own, and not all states are created equal. Some are better than others at distribution. New York, for example, is not bad, but it's only distributing 75% of the vaccine that it receives. It should be close to 100%. Now, as you know, the president has decided that he will take over and make a federal initiative for getting vaccine out. And that's what we needed from the beginning of this outbreak, not just for vaccines, but for all aspects of its control, and which we lacked. And so I'm hoping that we can get this vaccine into people's arms moving forward more efficiently.
The Biden plan, President Biden plan that you're alluding to is fresh out. It's very detailed. Well, it's very, it's 21 pages. Um, and on first reading, and I wonder if I'm reading this correctly, it appears to discard the idea of holding back doses, uh, the way we've been doing, but to get it all out there as fast as possible. Don't be holding on to doses for, waiting for the second shots.
But I feel we should get all the doses into arms. There's someone sent us an anecdote about a drugstore somewhere that was immunizing people, and then at the end of the day they had doses left over, so they said, hey, anybody out there want a vaccine, come and get it. I think that's the way it should be. Give it to people who are there at the time. And the CDC, as you know, has made guidelines for who should get it first and second and third and so forth, and that's fine. But if you're not getting 100% of the vaccines into arms, you have to be more flexible. So I agree with that. Vaccinate as many people as you can and get the companies to make more vaccines.
Even though at this point, I take it the science doesn't back that decision.
Well, I'm not saying that we should only give one dose to everyone. I think everyone needs two doses because the FDA EUA was based on two doses in the data generated in the trial by two doses. And there are a lot of people saying, let's just use one, but we don't know how effective that would be at preventing COVID. And that's what we want to be doing here. Now, in the UK, they have delayed the second dose 12 weeks so that they can get first doses in more people. And that is an option as long as you get that second dose in there 12 weeks later. Of course, the downside to that is in those 12 weeks, people may get infected. And even though they won't get serious disease, maybe after the first dose, they may still be able to transmit. So, it's a bit of a chance that you're taking.
I wonder if you think we're in a race against time here. I mean, it sounds like you're suggesting that. And I wonder if that race is complicated or how much it's complicated by the fact that vaccine has mutated. Do we need to get as much vaccination, as much protection out there before this thing mutate, the virus mutates enough to perhaps reduce reduce the potency of the vaccines?
I think we are in a race, but it's not against variants of the virus. They're rising, but the vaccine is going to protect against them. We know that so far. All of the variants that have arisen in the UK, South Africa, Brazil, California, they can still be blocked by the immunity produced by the vaccine, which is not to say that in the future, variants won't arise that are less well blocked. That's fine. But right now, in this year, 2021, I don't believe any variant will arise that makes this vaccination less effective. What we're in a race against is people dying, right? Well over 4,000 people a day in the US. I'm sure it's going to exceed 5,000. I'm sure we're going to exceed 500,000 infections, 500,000 total deaths in the US. That's the race we're in.
One estimate I saw from a scientist said we're going to have 500,000 deaths by the end of February.
Could be. It could very well be, because the cases are huge, and they're not huge because of a variant, a new virus. They're huge because people do not take the precautions that they need to take. They don't wear masks. If they do, they don't wear them properly. They don't physical distance. They don't do all the things that they're supposed to be doing. I see that on a daily basis here in New York City. And as a consequence, with the holidays and kids going to and from colleges, this just seeded the virus everywhere. And that's why we're in this position. It has nothing to do with variants. It's the way the virus has been since day one. And so that's the race. We have to vaccinate to cut down on those deaths and hopefully cut down on transmission.
There's an awful lot of information out there about the vaccines in the news media, in social media, and a lot of it is frankly dead wrong. And I'm hoping we can put to rest some of those myths, if you will. But let's start. Let me tick off a couple of things I think we know. That these vaccines are essentially 100% effective against serious COVID-19. Is that fair to say?
Yeah, some of them are close to 100% effective against severe COVID. That's right.
And the efficacy levels in general, how potent they are 90% in what was referred to as, to me anyway, as in the short term. Is that fair to say?
Yeah, the two mRNA vaccines that we are mainly using in the US, their efficacy is in the mid-90s at preventing any kind of COVID. That's right. That's absolutely correct. And you're right. It is. We don't know how long that's going to last. That's only been tested after, 2 months or so. So
that was a question I was coming to next in terms of stuff we don't know. But just to put a bow on what we just said about the efficacy, Dr. Tom Frieden, who used to run the CDC and of course was health commissioner here in New York, Tom Frieden wrote a piece saying, we're underselling these vaccines. People have there's a lot of misinformation out there. And he said that any vaccine that has 90% or more efficacy is a game changer, to use his term.
It is remarkable that they are so efficacious. These two mRNA vaccines, those are the ones we're talking about, because the others we're not sure about yet. Over 90% is really remarkable. And to get that number within a year of the pandemic is amazing. It's a scientific and public health triumph, really. And so people need to understand this. All people seem to be focused on are side effects and what this vaccine is going to do to me in the long term. Is it going to change my DNA? But folks, it's going to prevent you from dying. And that is the miracle. And that's why you need to take them.
Let's kick off, Vincent, some stuff we don't know, and you touched on one a minute ago. How long the immunity lasts? How do we, what should we think about that? How concerned ought we be that we don't know that?
We simply don't know, because it's only been a few months, how long they will last. What we do know is that the people who have recovered from COVID, they have immunity that looks like it would last for years based on comparisons with other virus infections. So that's good news, that the recovered people. And so The vaccines are not a virus infection. They're very different. It's just giving you the gene for a single, or the mRNA for a single virus protein. It is not an infection where all the virus proteins are made and the virus can play with your immune system. So we don't know how the vaccine is going to do compared to the infection, but in terms of longevity, and that's something we have to look at as we get further and further away from people being immunized. We're going to be looking at that. And in fact, the phase 3 trials that Moderna and Pfizer reported on last year, those are continuing for another 2 years. So they're going to follow up and they're going to tell us, hey, it lasts at least a year or maybe even longer. I doubt it would last less than a year, frankly. But the question is how longer?
Something else, ticking these things off, I think we don't know is whether vaccinated people can still get COVID, and if they can they spread it? I guess if they can get it, they can spread it, but talk about that.
So that is a very important question, in my view, one of the more important ones. If you are vaccinated, we know it will prevent disease because the vaccines have been tested for preventing vaccines. For preventing disease. That's the only thing they were tested for, to prevent COVID, both serious and mild COVID. We don't know if the people who are vaccinated can still be infected with the virus and whether they will shed enough to infect someone else. In other words, can they still transmit it? That's really important. And people say to me, well, when I'm vaccinated, can I throw away my face mask? No, you can't yet, because we're not sure if you could be infected and transmit it. And both companies, Pfizer and Moderna, are right now doing studies to answer that question. We should know within 2 months whether vaccination prevents transmission. That's a key point here, because if it does, then we can build up herd immunity and we can protect the people who are, for whatever reason, not vaccinated. And so it's very important to understand this. Many people cannot understand the difference between infection and disease. You can be infected and not get disease, and the vaccine is a way of doing that, but you might be able to still shed enough virus to transmit. Now, if you ask me what I think the vaccine will probably block. I think the vaccine will allow virus to get into your nose and reproduce a bit, but at very reduced levels, and therefore you're not going to transmit very effectively. That's my prediction, and we'll see if that's correct.
How long do you think before we have data?
I think we should know in March whether it prevents transmission. And, by then we'll have a good fraction of the population immunized, hopefully, and then we can say whether you can go back to your normal lives or not.
We're looking at a pandemic. We don't know if it's going to continue to be a pandemic or endemic. In other words, are we going to have to, do we know enough at this point to know whether we're going to have vaccines, every year, like we do for flu shots every year? Mm-hmm. Do we know whether we're going to have that regarding this disease?
Right. So I think we can make some predictions here. And first of all, the virus is not going away. It's here to stay. You add it to the list of human viruses, of polio, smallpox, smallpox is gone, measles, all the human virus. Now SARS-CoV-2 is on the list to stay. It's not like SARS-1 that went away after 8,000 infections. SARS-CoV-2 is here to stay. The question is, will 1 or 2 shots last your lifetime, or are you going to need a shot every year? And if you asked me last year, I would have said 1 shot should last your lifetime, because I was not aware of any evidence that coronaviruses could change like flu does. So flu, right, can change from year to year. And because of that, you need to get a flu shot almost every year. And I always thought coronaviruses didn't do that. But now there's evidence emerging that coronaviruses can change. There are 4 coronaviruses that cause common colds. Over 90% of people get these viruses every couple of years, and they change every 8 years or so. We don't have a vaccine for them because the infections are too mild, but these viruses change every 8 years or so. So you're no longer immune to the new strain compared to the one you got. So that means coronaviruses can change like influenza virus does. So I assume that SARS-CoV-2 is going to change, and we may need to reformulate the vaccines every couple of years, perhaps, like we do for flu, and immunize people. So that's my thought on what's going to happen here. It's a problem. It won't be a pandemic. It will not cause a lot of disease at some point, because we'll be able to vaccinate, but we may need to change the vaccine periodically.
You mentioned smallpox as you were just talking now, and of course we've eradicated that. And it called to mind a statistic I saw that I just found extraordinary, that there was an outbreak of smallpox in New York City in 1947.
Right.
And in a month, 1 month, we, New York City health officials, I guess, vaccinated 6 million people. Now,
Yeah.
what has changed that we can't achieve that kind of success here in 2021?
Well, I can immediately think of two things. First of all, we had been making the smallpox vaccine for many years before 1947. So there were large quantities of it. Companies could make many millions of doses, and we had stockpiles. And the second thing is we had no internet. We had just radio and newspapers, and false information was harder to spread back then. Not to say it did not spread, but it was harder to spread. Anti-vax sentiments were far less prevalent. And most people recognized the dangers of infectious diseases. They recognized influenza from the 1918 pandemic. They recognized smallpox, of course, polio, measles, et cetera. And so when public health officials said you have to be vaccinated, they said, okay, we'll do this. And the smallpox vaccine, as I said, had been used for many years. And so I think all of that conspires to get it done. And whereas today, one problem is the manufacturing isn't yet there. We don't have enough doses for everyone. And secondly, many people are suspicious of the vaccines. I get these questions all the time. What's the vaccine going to do to me in the long term? What are the side effects? Am I going to die from it? And back then, we didn't have any of that. So that's a big difference. I'm not saying it's bad to have this awareness, but as you said earlier, along with, the internet makes it very easy to spread truth and not truth at the same time. And they're equally spread. And that's the problem.
I read somewhere that somebody pointed out, a scientist, I believe, can't remember his name or her name, but that the COVID-19 disease is the first disease to have an anti-vaccine movement before we had the vaccine.
That might be true. It might be true because most of the vaccines we use are quite old. The most recent ones I can think of for sure have anti-vax, the human papilloma vaccine. It might have had an anti-vax movement even before it came out because, this is a vaccine you give to kids to prevent sexual transmission of the virus. And the parents don't want their kids to have sex. So they said before the vaccine came out, I'm not going to give them this vaccine, so this may not be new, but it's an interesting thought.
You mentioned manufacture. At the moment, are the drug companies manufacturing enough? Are they meeting the demand with their supply?
Oh, no. So, we were supposed to immunize 20 million people by the end of 2020, and we achieved only a fraction of that. The production has not been as strong as either Pfizer or Moderna said it would be. They both said they would have, between the two, they were supposed to have 100 million doses by the end of 2020. That hasn't materialized. And they both said in 2021, they could make 500 million to 1 billion doses each. And we are not on track to do that. So the production is part of the problem. And this is not indicting either company. It's not easy to suddenly make 1 billion doses of anything. And so it's going to take time for them to do it. But I have confidence that they'll be able to do that. I understand Pfizer is retooling its production facilities and they'll be able to make more doses. So all that is good. Now, at the same time, a company in India is making many, many doses of their vaccine because they decided, last year they were going to take a risk and start tooling up production even before they knew about the efficacy of their vaccine. So production is an issue for sure, but it's not the only issue. Getting it into people's arms right now is the bottleneck.
And just to repeat what you were saying at the top, to emphasize it, you think that given the new president and the new administration and essentially the federalizing, taking this over, we're going to see an improvement in getting it into arms, getting through this red tape, this idiocy of we can't get, here in New York, we can't get, my appointment has been canceled. My appointment is, I can't find one. All of that is in the process, do you believe, of being corrected by the fact that we're finally going to have a federal presence in this?
Yes, I think when it comes to public health of a country, that is a federal mandate. And I understand, it is not consistent with, Republican Party philosophy of, less government and so forth. And they're entitled to their views on that. But when it comes to public health, it doesn't work at the state level because not all states are equivalent. And so, yeah, I'm hopeful that this change will make a big difference. And I just wish it were in place in January of 2020 and applied not only to vaccines, but to every other aspect of pandemic control. We could have, not eliminated this, but made a much greater inroads into preventing all those deaths.
On that point, or in that same area, there are those who believe, not a few, that this country's whole pandemic response system needs widespread overhaul, that we've experienced a systemic failure, at least partly because of the politics. The Trump administration just kind of wished this thing would go away and didn't want to think it was around, and we know all that. But also because of years of underfunding of public health.
I think there are two aspects of that. There are responding to the virus. In other words, being ready with a vaccine or antivirals and not having to wait a year to develop those. We could do that. And I think I mentioned this to you the last time we spoke. In my opinion, this pandemic should never have happened. We could have been ready with an antiviral that would have taken care of this in China, or certainly in the US when those first cases arose. If we had an antiviral that worked, we could have taken care of it. And the reason we didn't have such an antiviral, well, first, the companies didn't want to develop it because there was no market, and they're for profit, obviously, so that's understandable. So then it's up to the government to develop that. And the NIH would be the main funder of such research, and their budget is ridiculously small. Now, you may say 35 billion or 37 billion a year is not small, but yeah, in terms of taking care of the public health of the US, it is. And we should have had more money put into development of pan-coronavirus antivirals. That's pretty easy to do. And in fact, now there is an antiviral that's been shown to inhibit many viruses like SARS-CoV-2. It blocks transmission in animal models. And that, guess what? That drug's been around for years. Nobody just developed it. And if we had, we would have been ready. So that's one part of the response. I want research ramped up to accommodate any new coronavirus that comes out of an animal, because they're going to happen again in the future. It's been happening once every 10 years. And I would guess that's going to stay the same, if not more frequent. All right. So basic research at antivirals and vaccines, doable. Well, this stuff, we're amazing technologically at what we can do. There's no reason we can't do it. And if you think about the trillions of dollars we've spent on recovery, a fraction of that could be used to make these drugs and vaccines I'm talking about. That's one arm of it. But the other arm is the response once the virus gets here. If we have to respond, if the drugs aren't available for whatever reason, I would hope that they are, and we don't need a response. But what do you need? And this was absent in this country. Face mask stockpiles. Very simple thing. Start now stockpiling face masks. We have a strategic petroleum reserve, but our health is more important than our cars, in my opinion. We should stockpile face masks. We should have modalities for testing in place. The CDC should be running testing, and they stumbled at the beginning. They can get the test right here, and that's crazy. There should be a procedure in place to immediately develop a test and distribute it to as many labs as possible. Ventilators, we realized early on there was a shortage. We have to have a plan for that. We have to have stockpiles, or we have to have them distributed, find out where they are, how they can be remobilized, how we can mobilize hospital beds and so forth. And back to testing, not just developing the test, but have a modality for detecting nucleic acid and viral proteins. Have these tests ready to go. That's all part of a pandemic plan. And part of it was actually developed during the previous administration, the Obama administration, but the plan was discarded, and the committee that that had drawn it up was disbanded by the Trump administration. So all of that can be done. It's not going to cost $5 trillion, I can tell you. And it will be really useful in preventing the next problem. We didn't have to go through this at all. All of this could have been avoided.
Dr. Racaniello, I wish I could take that part of this show, the last 5 minutes, and send that recording to the Biden administration and say, listen, you got a plan? Here's a plan. Do these things and we'll be fine, because another virus, another serious virus is coming one day. It is a delight to talk to you. There's so much more we could talk about, and let's do this again, Vincent.
Tony, I'm happy to speak anytime if you want to speak more frequently. It's my pleasure. You don't, I think it's important to get this message out there. I think people need to get the message from scientists like myself. As you said earlier, the press gets a lot of things wrong. And can I just point out that the stories about this variant or variants have been inflated by the press. They're just not correct. I see in the New York Times all the time, the more transmissible variant has arrived in New York. That's just not right. We do not know actually if that virus is more transmissible. There's some suggestions there are, but it's incorrect to conclude that. So it's a long way of saying I'm here whenever you want me.
I appreciate it. And I thank you.
My pleasure. Anytime.